Clients will often come and talk to me about a very large area of negligence that we can call surgical errors. Well, when you think of the fact that if there's a specialty, there's a surgical specialty to go along with it, this is a huge area. There are kidney surgeons, heart surgeons, back surgeons, foot surgeons, you name it, there's a surgeon who deals with whatever the body part is. And as a result, the lawyers who look into the medical practice in question, the surgical practice in question, have to be just as specialized as the kind of surgery that's in question. People have heard, no doubt, about cutting off the wrong part. Well, thankfully, that happens much less now because the surgeons got together, the hospitals got together, and professional associations got together, and there is now a protocol to specifically address the issue of making sure that the right body part gets operated on. And it has to do with, at the time of surgery, the nurse calling out and the physician responding, left arm, left leg, or whatever it might be, and making sure that the right body part is being operated on. And because of that, I don't expect to be getting too many cases like that, and isn't that wonderful? I hope there aren't any anymore. Having said that, there are other kinds of surgery cases that will still exist. And one of them has to do with when a surgery is being performed, wounding, cutting, or otherwise injuring a nearby structure that's not the subject of the operation. Now, when that happens, the defendant can and will claim this is a risk of the procedure. And sometimes they may be correct. After all, depending on the body part that we're talking about, things can be really close together there, and there can be so little room that a little nick here or a little cut there might be something that happens. But having said that, if that's the case, the surgeon knows that ahead of time, doesn't he? Or she. And as a result, one of the things that needs to be looked into in a case like that is, what steps, if any, did the surgeon take to avoid this harm? And so if they didn't take adequate steps to avoid the harm that they knew could happen, well, then that might be a viable case. I think the best thing I can say about surgical errors in this regard is don't jump to conclusions about whether you do or you don't have a case. If you have a case that involves a surgery, I urge you to please call us and let us look into it to see if we can help you.